Hey, folks, welcome to another episode of Broken Brains with Bruce Parkman, sponsored by the Mac Parkman Foundation. Our podcast is focused on the issue of repetitive brain trauma in the forms of repetitive blast exposure and repetitive head impacts, and what these impacts are doing to our population of athletes and children and our veterans and warriors. And we go out there and we find the leading experts and people that have dealt with these challenges and researchers, doctors, and authors, and bring them on the podcast so that you can be informed. Why? Because this is the largest preventable cause of mental illness in our warrior and child populations. And this is not taught in medical institutions. And you have to be empowered with the knowledge to take care of yourself and your children, or as a veteran, to go seek treatment. Today, we've got an amazing guest, man. We love this guy. We've been so fortunate to work with him before. Dr. Joe Dituri, doing so much for our veterans. It's actually Commander Joe Dituri, is a retired U.S. Navy officer, deep sea diver, and biomedical engineer. He has 20 years of active service where he specialized in hyperbaric system saturation diving and submarine rescue, which makes him borderline psychotic if you live in a can for all that time. Serving in roles from special operations officer to chief engineer for undersea systems. After his military career, he earned a PhD in biomedical engineering, focusing on life support systems and hyperbaric medicine. Dr. Dituri is a professor at the University of South Florida, a very big partner with the Mac Parkman Foundation, a published author, and a consultant on undersea medicine. And I do believe he holds a Guinness World Record. We'll have to talk about that. Passionate about exploration, he continues to push the boundaries of human endurance and has a lifelong dreaming of becoming a civilian astronaut. And you're in the fine state of Florida over here, so hopefully we'll get you in front of Elon to make that happen, dude.
1,000%. Anything, if you got an insight to Elon, please let me know.
Oh God! After I get talked about kids and veterans, you're gonna be number two. So I gotta get this guy to make a great astronaut, boss man. Get over there, man. Joe, welcome to the show, man. How you been, buddy?
Thank you. I am well. We are so good it's criminal. I can't even complain. So I'm doing great. Thanks. How are you guys?
Dude, we got it rocking. So we're gonna have the second conference this September. So that's we got the town hall in a couple of weeks. You're gonna be on the panel there. Looking forward to that. That's gonna be great. We're gonna be running seminars. So now we're jamming. Just got back. We'll talk a little bit about Congress. We now have legislation covering hyperbaric oxygen in front of Congress right now, and here in the state. So yeah, we're doing everything we can as a small foundation. Punching above our weight and just, like that little chihuahua, right? Don't stop tearing them big dogs up,
There you go.
all we can. So, I mean, a lot of folks, tell us how you got into hyperbaric, because I really want to dive into this study that you're doing right now.
Right.
And why do you feel like you talk about the cutting edge and exploration of treatments? Why do you feel and why is hyperbaric oxygen or any modality that's not conventional so critical to our veteran population?
So the interesting part is I retired from the Navy and I'm sitting at Admiral McCraven's house drinking a beer, and he's like, "What are you going to be when you grow up, Aquanaut?" And I'm like, I don't know. He's like, "Hey, do me a favor. Would you mind sitting on the preservation of the force and family?" So I said, "Yeah, I'd do that for you as a favor. I got a favor from Guido Balducci. Sure, I'll do that."
Kiss the ring.
So I go in, I do this, I sit on that thing for like 6-7 months, and I go back to him and I says, "Hey, boss, they're not doing it right. All they're doing is talking. We got to move the needle." And he looks me dead in the eye and goes, "Permission granted, Aquanaut. Fix it." And I went, shoot, now I have to go do it. So I went back, I got a PhD in biomedical engineering, and I started fixing brains with the only thing that I knew that increased cerebral blood flow, which was hyperbaric medicine. I'm like, I've seen it work. It works for other things. It works for problem wounds. This is a problem wound that's not healing in the head. It's an open wound, a closed wound. It's a different wound, whatever. So I'm thinking maybe this is going to work. So I'm running down the road with scissors, right? And the good Lord says, "Look, you got to make a right. You got to do it differently." And I says, no, I got it. And he says, "I said, make a right." I said, "No, I got it." So he throws a 6,000-pound SUV at my 47 Chevy, T-bones me. I get a 8mm hemorrhagic stroke in the prefrontal cortex on the left side. Now I have a really bad traumatic brain injury, and I'm in the hospital for a week, 2 days in the ICU, 5 days in the regular hospital. They finally discharged me, and I'm like, I know how to fix brains. I'm going to go in the hyperbaric chamber, and it just wasn't enough. that alone wasn't enough. So I had to figure out a way to heal myself so that I could get these studies, these things, these scientific, reach in, find the science behind it, and then combine it with other stuff and get people healed. I think the good Lord just wanted me to do that. So I said, yes, sir, I'm on board.
Man, I'll tell you, when you don't listen to the Lord, He's going to make you listen. I've got so many stories of, and it's just like, you arrogant mortal. How do you dare you?
I said turn right.
I said turn right. And guess what? You're turning right. Not right now, but you will turn right, right? Dude, man. Yeah. And so, how did your healing go? I mean, you went, obviously now you're in the self-medicating, mode, man.
It went absolutely horribly for the first month. I fell into a very deep depression. And then when I got despondent, when I got to the point of suicide, when I got to the point when I was going to take my own life, I said, okay, I got about a month and a half before I'm going to take my own life, but I'm Catholic, so I have to do everything, because when I'm standing at the pearly gates, I got to get there and tell them, look, I tried everything. So I did everything at once. Red light therapy, beamer mat therapy, cognitive behavioral therapy, structural energetic therapy, physical therapy, neurofeedback therapy, ice baths, saunas. And all of a sudden, man, I came back. And when I say back, my traumatic brain injury was the best thing that ever happened to me, because I can heal. I healed myself. And I have been healing others. I took a professional football player. I put him side by side in the same exact therapy I had with a Green Beret who lost his entire platoon in Afghanistan. And freaking these two guys, after 1 month, got dramatically better. So much so that their wives came to me and says, all right, first of all, I want to marry you. Second of all, what did you do with my husband? And I'm like, well, he's fixed. And they're like, I can't believe you cured him. He was done. He was gone. So we're trying, we're doing everything. So, but the lesson here is, what do? We have a closed head injury. You can't pop the top open and look. If you're not going to pop the top open and look, the imaging sucks like the Knicks. So we got to do something different. We got to do everything. Red light, beamer mat, everything, same time.
So when you did all that, did you do any psychedelics at all? Did you run down that road? With the NFL players or yourself, or
I did not do that with any of the NFL players. On a personal level, I have worked with organizations that have legally done psychedelics with me, and we legally administered them in a proper setting, and I believe that to be transformative if it is done in the proper setting, right? I do not condone people going out and doing it without medical supervision and just going on a trip in the woods and a walk alone. This is not the way to do it. But if done in a proper medical setting, I have seen great effect of it.
That's awesome. And because, the reason I asked that is, and we'll get into a little bit, is that, when you have a closed wound, right, you can't pop the top, right? And with the, one of the issues that we're struggling with right now in our veteran population is mental illness. Well, when it comes down to repetitive blast exposure, repetitive brain trauma, or a massive car crash right there, you have brain damage. And then obviously, like you struggled with depression, suicidal ideation, right? You go to a psychologist, what are they going to do? Right? They're going to fill you up a bag full of medications. They're going to give you therapy, and none of that's going to help you with your problem, which is a damaged brain. So all these modalities that you're talking about, photobiomodulation, vagus nerve stimulation, hot cold plug therapy, stellate ganglion blocks, everything, including psychedelics, none of them are covered by insurance plans, TRICARE, VA, and that's part of the challenge. But the issue is, how the effectiveness, how come we're still not, we're still not, when it comes to HBOT or any of these things, how come everybody's like, oh, it's still not properly researched, it's still not there yet. When I compare men and women soldiers that have been to a psychologist, and my daughter's a nurse practitioner, she has a 25% chance of any drug taking effect, and those drugs are going to kill them. Yet people leave your program, people leave these psychedelic programs, people leave all these other programs. We have an 80 to 90% population survey saying this has improved me, this has helped me, and more than anything, why is this not available? Or where does HBOT research have to go for it to become accepted now so that these veterans can get coverage?
Yeah, so that's a great question. And what I'm going to do is I'm going to answer your question with a question. Who does drug company trials? Drug companies, right? Drug companies. What is the drug company for hyperbaric medicine? Oh, there is none, right? So nobody can afford to pay for the trials. A drug company can go, here's a red pill, here's a blue pill. You take this, one's a placebo, one's the real pill. And they can do it to thousands of people and get these upchecks in the way that they do research and be like, yeah, we got a positive whatever. We do not have a large enough N. Every hyperbaric study that's ever been done was in the, 100 was a crazy high number. Most are in the 20s and 30s, which is not passing the professional test of the drug company model of research, right? But what we have to do is step back and go, what do these people really need? We need to get them off the drug company model and get them thinking about treating themselves differently. Look, you said it very clearly. You have a physical injury. So I got to heal you physically, physiologically, and psychologically simultaneously. Because if you don't, every time your physical shoulder that you hurt in that same traumatic brain injury car accident, it goes, oh, through the vagus nerve, it goes, oh, reminder, you have a traumatic brain injury. Oh, yeah, you have it. So if you don't heal it, you're going to keep reminding yourself of it. At the same time, you got to do all these things, and hopefully you can get them to be better and pass and, get somebody better. But remember, your TBI is not my TBI, is not his TBI. It's like everyone's different, right?
And that's why you got to throw the kitchen sink at it. But my point, the kitchen sink, and my point, Joe, is that look, when we still have not impacted the suicide rate in veterans, right? And we still got hundreds of thousands of Americans struggling with mental illness that have not ever been assessed for contact sports exposure, or they left the military and they've been exposed to TBI, MTBI, the whole 9 yards. Why do we have to wait on all these stupid trials? And we have all these studies, and every one of them that I've read has indicated that they have provided a positive impact on the brains of veterans. And
Right.
We've got to get out. What we're pushing for in our legislation right now is, like you said it before, we've got to move the needle. All this talk about biomarkers and crap. We have studied, concussions and TBIs to death. All right. We know they're a problem. All right.
Yeah.
So when are we going to do something about it? Because right now we're not. And it's people like you that are fighting the system to get the funds necessary to conduct these studies that could change the paradigm that nobody's focused on for all these, because everybody was doing this. I am so sick of researchers asking for money to restudy stuff that's been studied over and over and over again because nobody shares their data. Everybody's fighting for research dollars, and they all drive big cars, right? I'm just done with that, bro.
Right. Think about it. I have no incentive because I'm not getting paid for capitalizing on other research. All I got to do is say that your research wasn't good enough because you had one person in your study paid for it. So that throws the whole study out, or your statistical significance was this close, but not that close. It's just like, my job is the Capital One no guy. Now, listen, science wins over bullshit every time. Right. And that's what we need. We need a hard science approach. That's why at the University of South Florida, we are doing that study with 420 veterans. 420 veterans. That's because it's funded by the state of Florida. The Florida legislature came off the dollars and said, University of South Florida, go fix this problem. Tell me whether or not it works. And that's what we intend to do at the University of South Florida. So we are working it. It's just a matter of time. Like, we got 3.5 more years left on this study. So we're not going to get the results out today. They won't be out tomorrow, but we have to wait. Right. So, but the science wins over BS is the thing that we're working with. And by the way, your health insurance covering it, health insurance has absolutely nothing to do with your health. I'm sorry. Yeah. I know I'm shocking you, but health insurance doesn't care. They are a for-profit company. They have a board of directors. They will not lose money. So in the end, if hyperbarics cost $1 billion across the spectrum of their covered and broken arms cost $1 billion, one of a couple of things is going to happen. Either we're going to start treating hyperbarics and stop treating broken arms, or we're going to start treating hyperbarics and everybody's policy is going to go up by $1 billion, maybe $1,001,001, so they actually make money on the deal.
They make money.
It's a for-profit corporation with a zero-sum game. They don't care about your health.
Yeah, you're right. You're right to the point, as always. I mean, there's just no, it's good. I mean, people need to hear this, man, and they already know it. They deal with it, but when it comes to, and that's the other thing, is if we could take a TBI person, right, and say anybody, right, you look at, when we talk about repetitive brain trauma on this show, but the gaps in repetitive brain trauma, from education and awareness to diagnosis, treatments, insurance coverage, billing codes, are the same for most TBI patients when it comes to this. If you're a TBI patient, you've got a physical injury and you're being fed a bunch of drugs, you're being sent to therapy for the rest of your life, yet your injury keeps sitting around and getting worse. Yet, all these things that could help you not only are not available, but what would be the cost of, say, 40 HBOT treatments that could get you to a whole nother level of compassion and together versus the lifetime of drugs that these pharmaceutical companies want you on?
Yeah, even at the highest point of hyperbaric treatment, the biggest dollar value that I've seen in a little while, it'd be $10,000 to do that treatment.
$10,000.
But nothing. It's pale in comparison. It's a drop in the bucket, because I have veterans that come to me hooked on 11 medications. Oh, you didn't sleep well last night? Let me give you a little pep me up.
Yes, sir.
Oh, you got a little pain? Let me help you out. Oh, you got that midday lull? Let me help you out. Oh, you can't sleep? No problem. Let me drug you up.
Oh, we got
now
you.
You're sluggish the next morning. Let me wake you back up. I'm like, so I kick them off all 11 drugs, and it's me and a whole bunch of physical providers, right? MDs, PhDs. We all sit around and we group around the patient. Who the hell does that? Nobody, right? I come to the patient. The patient doesn't come to each individual doctor. All of us sit around in a group and we go, okay, how does this interact with that? What are we going to do if we do that? If we do that, that'll open this up and this up. So we're doing all these things together, and the doctors are around the patient and they are taken off of every drug that they were ever on. I still got guys that come back to me, Green Berets, Navy SEALs, these military guys that come to me, these police officers that we've cured, these football players, and they go, dude, you saved my life. And oh, by the way, I'm going to parade my daughter in to see you because you saved her life too. Because what happens to the father when the father takes his life? The girl does what? She's got daddy issues the rest of her life. She's miserable because she thinks it's partially her fault. These people are bringing their kids in here. It's the most wonderful thing I've ever had in my whole life.
I mean, and it's so. I mean, the universe on this whole medical thing is upside down. I mean, it's crazy what we're coming across. And HBOT, I mean, is it can be so effective. And do you think there's going to be an HBOT standard? Like, we look at, we went to another company here in Florida. They were out in the villages. They got an HBOT machine, right? And they're like, Dituri's not doing it right. And I'm like, why do you say that? Like, well, we do it this way. I'm like, well, I don't care. Right. The thing is, to me, oxygen is oxygen. I don't care if you get it in a tent, if you get it in a mask, or if you're in a goddamn chamber. So is that going to be part of the problem? Is agreeing to a precise protocol for this, a number of treatments, a percentage of O2, or what? Or
this is the problem. So what you're seeking, the words that you're seeking in drug language are minimum effective dose, right? I'm looking for the minimum effective dose. However, old school says we start like this. New school says we do like this, right? So we got to change the way we think about research and research done in general and go with perfect is the enemy of good enough. There is no funding for these drug company level trials. We're not going to get 50,000 participants in hyperbaric oxygen and 25 of them being in a placebo, 25,000 of them being in a placebo. It's never going to happen, right? So we need to change the way that we're doing this and focus differently. A little bit of oxygen is good. A lot of oxygen might be worse. It might be better.
And then you got the whole problem of everybody's brain being different. Like you said, every injury on every brain is not a broken arm. Okay. When you
Yeah.
you fracture everybody's bone right here, you're pretty much going to set most of them the right way, the same way, right?
Yep.
Here, you've got different angles, rotational force. You've got,
Yep.
different,
Shearing, axonal
sharing,
injuries.
all
Yep.
that stuff, right? And so, yeah, I mean, and that's where it needs to be dialed in based on the patient. But let's talk. I mean,
And this is
go
when we
ahead.
talk about practicing medicine. These doctors
What a concept.
practice medicine. Let me give you a very profound statement. Listen, if you've seen one traumatic brain injury, you have seen one freaking traumatic brain injury, and that's it. You try and
Amen.
lump these MFers together, and all these people are going, well, it's the same as that guy. No, it is not.
Nah,
It is
nope.
absolutely not. This guy got it from a blast injury. This guy got it from a car accident. This guy got it from repetitive hits to the head. He was a boxer. He was a football player. It's totally different.
Are you seeing the effectiveness of HBOT? Like you just described about 6 or 7 different ways to get a brain injury. And so that's the beautiful thing about HBOT is that it is oxygen. It is in the blood, I guess. So there is, you actually don't have, some of the difference, the variances in injuries I mean, they're all injuries and they all can
Right.
be healed. So that's
So
pretty amazing.
yeah, we see some healing in hyperbaric oxygen, but let me just tell you something. Hyperbaric oxygen doesn't heal anything. And everybody goes, oh, you said a bad word. No, hyperbaric oxygen helps your body heal itself. That's all it does. It has certain mechanism of action like toxin inhibition. That is a known mechanism of action, peer-reviewed, published literature. Same thing with hyperoxygenation, increases cerebral blood flow, reduces edema, reduces reduction of inflammatory markers. All those things are known. Reduction of neuroinflammation, increase transcriptase, reverse transcriptase. So we have all these known MOAs. We just have to apply them. And then once we put somebody in hyperbaric oxygen, naturopathic cure, it stimulates your body's processes to go ahead and heal itself. That's it. That's all it does. No drug, no hook, no connection, no comebacks, right? That's the thing. I'm not on a model where you have to come back every fucking 6 weeks and look at me and say,
ARR, bro. Yeah.
I want you to return and pay me more money. Oh, you're not done with therapy yet. Who
No.
tells me whether or not I'm done with therapy? The freaking therapist that I'm paying.
Yeah.
I can't. And I'm like, I'm just a PhD. I can't.
Well, I know in the business world that recurring revenue models are the best. In our medical field, that's what they're looking at is recurring revenue. Everybody's going through it at ski resorts. Here's your ski pass, pay for the whole year, right? Or you're going to pay $300 a day. Everybody wants that recurring revenue, and it's a shame. It's a tragedy. That's where we're at in terms of how we look at medical, the way the medical industry works. I mean, look at the savings. $10,000 a treatment versus how many pills do you take in a lifetime at what do they charge for these pills? $150, some crazy amount of money, right? You're talking about reducing costs to the nation, to the taxpayer by 2.8 million TBIs a year. And that's only the ones we know about. Right. And I mean, gosh, you're talking about, just I'm going to have to calculate that one day just to kind of come up with a number because that's what politicians listen to. That's, they're like, oh my God, we're going to put money back in our products. Yeah, this stuff pays for itself. And the machines, how much does an HBOT machine cost right now?
100 grand, 125 grand, something like that. We have to do it right. You have to do it correctly. We just had an explosion at a hyperbaric facility that was doing it incorrectly up in Michigan. So everybody's now scared. Everybody's like, oh, those crazy hyperbolic machines. Okay, first of all, it's hyperbarics. But and when you see this kind of stuff, you go, okay, well, every single incident that's happened in a hyperbaric chamber since 1985 can be attributed down to the technician being poorly trained and letting things happen that shouldn't have happened. And that's it. And I mean, I happen to train these physicians and practitioners to operate these chambers. And I go, listen, here's the way to do it the right way. And if you forget, hey man, that's on you. Sorry, we told you.
No, I mean, if you also look at the number of people that have taken their lives because they've been on psychiatric care that didn't work when all they had, well, not all, but they had a brain injury that wasn't addressed. I mean, I'm sure that the numbers are very, very inverse when you look at those populations there, and that, accidents happen,
Yep.
but it's about the efficacy of the treatment,
I
and
mean,
I mean,
look at it like this. I teach physiology, and if you break it down to the human physiology, right? I don't know what's causing you, let's say, to not sleep. I don't know what's causing you to not sleep, but I guarantee you it is not a deficiency of Ambien or Ambien CR or Lunesta or Valium. So you're going to give me Valium or Lunesta or Ambien for my sleeping problem to make me sleep. But I'm not deficient in that. My body's not deficient. I may be deficient in melatonin. Okay, let's talk through that. Let's talk through magnesium. Let's talk through some of these real things that you're actually deficient in. But you don't have a deficiency in Lunesta. I can guarantee you that. What you giving me that drug, right?
Dude, my kid is in the 82nd Airborne, and he told me one day that he finally slept like a dog, and I was like, "What are you taking?" And he gave me this pill. I went and I called up my daughter. I go, "Honey, what's this pill?" She goes, "Dad, that's a benzo." I'm like, "What?" So I called him. I said, "Where'd you get that pill?" He said, "Wow, one of the other soldiers gave it to us." I said, "I want that TMC. They're giving out benzos for sleep." I said, and this is where we're going. It's like, I don't know whether they know that, you know, I don't want to get off topic here, but it's crazy, man, what we're doing to our children and anybody. Because you go to any doctor's office, I go to a lot of ayahuasca retreats. I talk to these veterans, right? And they've got bags of drugs, Joe.
Yeah.
I mean,
Shut up, take the
5-gallon
pill.
cans. And they'll go back and they'll say, "Look, I want to get off them." They say, "Well, no, maybe you need a little bit more." And every time they go back, they find another reason to give them another pill. It's a tragedy. So
Yeah.
well, let's talk a little bit about, when HBOT, like, so you have a TBI, okay? Is there a lot of the things that you said that HBOT reduces, inflammation, toxins, all these things are obviously very, very good for the brain and are some of the key components of the degradation of the brain from long-term exposure to blast or injuries. Now, should somebody just if they have a TBI, should they rush to you and go find you? Is there a time to wait between an injury and actually starting an HBOT protocol, or it's just for
Great
those that
question.
are uninformed?
At at the University of South Florida, our study requires that you be 1 year post blast at the very least. So, we don't want you to be fresh off of a head injury today, right? Or tomorrow or within the first 72 hours. So we said, oh, what do we need? Let's give it a year and we'll call that a number, right? And then it could be as much as, 70 years ago. I don't care because, well, it has 60, 65 years ago, something like that, because you could be 70 something years old and be in the study. So you have to have gotten your traumatic brain injury while you were in the military and you got to be old enough. So, that being said, if you have a mild to moderate traumatic brain injury, sign up on the QR code that we're going to give to you guys. Just click that QR code and people will just go and do, we'll induct you into the study, if you will.
Nice, man. That's amazing. So tell us about this study. I mean, it's the largest HBOT study I think that's been funded
Ever
to
been
date.
performed in the history of hyperbaric medicine. Our
I,
N is 420, which means
oh,
that there are 420 soldiers, sailors, Marines, airmen, even Space Force guys and Coast Guard. I don't care. Everybody, right?
take them
I,
all.
I'm an
Big
equal
Tent.
opportunity hater. I'm a Navy guy, so I hate y'all. It doesn't matter. So we're gonna take these people in, and we are doing a double-blind, randomized, placebo-controlled clinical trial. So this thing is like it's the gold standard. We're taking blood, urine, saliva, feces. We're doing diffuse tensor imaging. We're doing QEEGs.
Are
We're
you
doing
doing TTI?
yeah,
Wow,
DTI,
good.
MRI with DTI, absolutely right. So we're doing everything, and we're having our stuff evaluated by the experts in that thing. Like our blood goes to Duke, to the Duke lab, right? Our imaging goes to the best place in the world, which happens to be in Australia, right? For traumatic brain injury. So you see me, I'm not the only person. There are 38 researchers on this project. MDs, PhDs, neurosurgeons, imaging specialists, psychologists, psychiatrists, we got it all. right? There is nobody left, no stone left unturned. And, we're trying to get the best science we can out of this so we can either, look, put the nail in the coffin of hyperbarics and say ixnay on the Upid's day, right? It doesn't work. Or say, we're pretty damn sure it works. So here's what we're getting. And it's
And
an
even if it,
adaptive trial. Like, we have trial specialists that came in to help us with this. That's why, look, you want to go fast, go alone. You want to go far, go with a group, baby. So we went with the group.
that's awesome, man. How did you get the state to buy in on that?
It was not me. It was Dr. Harry Van Loveren, who's my boss. And he said, hey, listen, can you give us money? And what can you do? What can you do with this money? If I gave it to you, here's the thing. And he was like, shoot, they gave us the money. Now we got to, oh, wow. Now we got to really do something.
We got to execute.
This man is a neurosurgeon. He's the head of the Department of Neurosurgery. He does not do anything poorly, right? He does it at 1,000%. So it's like, okay, well, now I got to hire the right people. We got to pull the people on board. So he grabs me and goes, what do we need? And I'm like, you need 2 of these, 6 of those, a couple of those naked lady tees and this hat, and this, right? So we did it all. We got all these people. And then, psychologists said, hire this guy. And then psychiatrists said, hire this girl. And we put everybody in the same room. And we said, what do you think? And then we brought veterans in and we said, okay, you are our veteran survey panel. What would you like us to do? How would you like us to do it? And we're bringing in a medical anthropology study so that we can look at what are the reasons why you didn't want to get into the study? What are the reasons why you did want to be in the study? Why is HBOT working? Why is HBOT not working? Who comes? Who doesn't come? It's an important demographic, right? Because if you go take a pill or come 40 times over the next 2 months, which are most people going to do? I'm going to take that damn pill, right? Because I'm in the generation, fix it now, do it now, right this second, give me the pill, I'm good. But meanwhile, you don't know that non-steroidal anti-inflammatory use, consistent buildup, is harmful to your gut. So don't do that. You should be doing the naturopathic healing, but it's harder, unfortunately.
That hard right over the easy wrong. So what are you looking for in the study? I mean, you looking for a total cure or improvement overall, or
Yeah.
what are you hoping to get out of
this
the
is
study?
the problem. So it is very hard to figure out what a cure for traumatic brain injury is, and the FDA does not have a metric for it. So what we are doing is we are taking all of the physical measurements, all of the objective quality evidence like blood, urine, saliva, cortisol samples, QEEGs, the DTIs, and those things can show us things. And then we're pairing it with the psychologic tests, but nobody has ever taken the pairing of these things and pulled them together to one and go, look, psychological and psychosocial tests got better when we increased we decreased HSCRP and interleukin 6 and had all these increases in correlation and decreases in phase lag. So that's maybe going to be the definition of a cured traumatic brain injury. Maybe. We're working on it. We have no idea at this point, but we're researchers and we're doing it the right way because science wins, guys.
No, and that's the way it's going to be done. I mean, it's got to be done. And I'll tell you, those pictures are super, like DTI scans and QEGs. That's like evidence, right? That look, we've got, not to mention the lab values, right? The labs come back, they're all improved, and you combine that with the psychological issues. Everybody can just say I'm feeling better, whatever. I mean, it's a possibility, but when you put those both together, you're going to have a very powerful explanation. Because you're right. And I hear this all the time. Yeah, it's going to be amazing.
Like right now, there is no study that puts together the correlation of increased cerebral blood flow through diffuse tensor imaging, because you can witness increased angiogenesis. You can increase the production of blood or the promotion of blood to ischemic areas. You can do that. That there is no correlation to that and a cured traumatic brain injury in any literature. So you can't just say, yeah, increased cerebral blood flow equals cured traumatic brain injury. You can't.
Yeah, it's gonna. I mean, I think that all the things that are out there, they need to go through this type of study so that we can make them available. Now, if they become available, Joe, how do we scale this? Right? I mean, say, hey, you come up with the study, and it's like, man, HBOT is the bomb. If you've been, this is this is now going to be a protocol, right? This is going to be recommended, whatever.
Right.
It's going to be part of a protocol. How do we scale this and make this available? I mean, is there,
Do you
any limiting
remember I
factors in big
asked you
machines?
who the drug companies were? In my opinion, the drug companies for hyperbaric medicine are the hyperbaric chamber manufacturers.
Mm,
They're the ones that really stand to make a ton of money off this. Because
check.
even I had a center, and when I treated people, it cost me $183 to treat a person one time. And I would sell the treatments to military guys. I'd sell it to them for $200. Right? I mean, look, $3,000 a month rent. You got to pay the tech. You got to pay the
Yeah.
oxygen. two
No,
thousand dollars for oxygen, and
uh,
and and then you got to buy the chamber for
you made
$125,000.
$17 a treatment.
Yeah, yeah. So who's making the money? The drug
Right.
company is the chamber people. Those people need to start funding research, is my opinion. Those people need to start funding the cure of our veterans, is my opinion, because they're making money off of it. But I don't know is the answer. It's not easy. It costs a lot of money. The barrier to effective entry on this is you have to pay a lot of money. We're looking at, I spent like $300,000 setting up my center. And then I basically had to keep paying the bill every month for the rent
Yeah.
and the oxygen. And, my nut was crazy. So I had to fill those chambers with paying people.
Yeah.
Somebody's got to pay. Otherwise, it's never going to happen. And
And that's
I'm pro-military, man. I'm like, if the military guy came in, I'm like, screw it. We're going to treat you anyway. I don't care if we're going to pay.
nah, I hear you,
I'll
bro.
pay.
Yeah.
Doesn't matter.
Nah, and that happens with a lot of modalities out there. And bless you for doing that. I mean, it's
Right
just
thing.
something
It's
that
the least I can do.
no, and then and that's the whole thing is these kids, man. I can call them kids. I'm an old guy. Is they
Me
didn't,
too.
they signed a dotted line, man. They didn't commit any crimes. They went and fought for their country. Now they're hurting and nothing's available. And that's why I get so assed up about this. It's like, look, we have to do this study, but we've known, and you've known for a long time, HBOT is effective. HBOT has a positive impact on these soldiers, man. And when they're sticking guns in their mouths and blowing their brains out, I don't care about FDA.
Yeah.
I care about anything that can help these kids. And you're not going to die from HBOT. You're not going to die from anything out there unless you lie and say, I took my SSRIs and I went on an ayahuasca trip. And but all these modalities, the psychedelics, the electronic therapies that are out there, to include HBOT, cold plunge, all this stuff, you're not going to die from them. So why can't you try them? And if you've been hurt in the services country, why can't you get covered? And I just
Right.
think that, what
Well,
you're doing right now is you're absolutely pushing the boundaries of getting at least one of these modalities to that gold standard. And then I want to see what the pushback's going to be after that, because
well,
that's when it's going to get stupid, man.
honest to God, and don't personalize this, but the old white guy club is never going to let it happen. Right? The medical machine is never going to let it happen, right? Perfect case in point. I do ice baths. I like ice baths. They make me feel better. There's a 13% increase in brown adipose tissue as well. And there's cold shock proteins, and you get your breathing down, and there's so many ands that go with it. But one time, some guy with a heart condition went in there and he had a heart attack and he didn't have somebody wait. So ice baths can kill you.
Yeah.
And I'm like,
Yeah. No, no,
whoa, that
dude.
is not
Yeah.
what that means.
Ah,
The little kid got blown up in the chamber in Michigan. Therefore, hyperbaric oxygen can kill you and you shouldn't be doing it.
that guy died in a parachute accident. Oh my
Yeah.
God. Don't jump out of planes no more.
I mean, I'm tongue in cheeking this, but it's so hurtful to me that we will not just embrace therapies that don't hurt, that might help. That's what we need to be doing.
Don't hurt might help.
Don't hurt might help, right?
Dude, if we went back and looked at almost any suicide in this country where somebody's been on, drug care, black box warnings. Oh my God. You could turn that with, I mean, Those are, I mean, we lose the equivalent of 20 years of war every year in veteran suicides. Just veterans, you know,
Isn't that crazy? Isn't that
nuts.
crazy? That
And we
doesn't count
think that
domestic
we're
abuse.
solving
It
the
doesn't
problem.
count the football players. It doesn't count the, oh my gosh,
Oh,
the
no.
car accidents, the MBAs, oh.
We just did a study that I just found this out last week. They did a study of the inmate populations here in Florida. 83% of our inmates right now have have a history of at least 4.3 TBIs and repetitive brain trauma. A lot of them from football. 43% of kids in juvenile detention right now, from the age of 16 to 18, same thing. 4.3 TBIs or RBAC. We can address recidivism, incarceration. I mean, these guys and women that, suffered from domestic abuse, right, and violence, none of them are being assessed for the impact of their lives on their brains and the mental conditions that could have caused them to commit these crimes. And where the crimes aren't absolutely horrendous, can we at least get them treatment to improve their ability to function as civilians and get back out? And HBOT could absolutely, you put an HBOT chamber in a jail cell and have these people go there, go to therapy, find God. They can leave those jail cells as better human beings with a better chance of, and their brains are getting better, right? Because we have no idea how many folks are sitting in jail right now because they're mentally ill because of contact sports. Or we have, I think the last count was I think there's 180,000 incarcerated veterans in this country.
Right.
None of them have ever been evaluated for the impact of service or training on their brains, bro. And
it's a pandemic. It's
a pandemic. It is crazy.
During the time when COVID came up, we were trying to use hyperbaric chambers to treat COVID during COVID.
Now, how'd that go?
Yeah, it went poorly, right? They're it's not standard of care. That's what the hospital told me. And I was like, what's standard of care for a brand new thing? I don't understand. But that being said, we were thinking of ways to get an airplane which can hold a little bit of pressure, right? Get an airplane and have people with masks on that were breathing oxygen in the airplane, like hundreds of people at a time. That's what we need to start doing. Thinking about how to scale to hundreds of people at a time.
Out of the box.
Out of the box thinking. This is and that's what needs to happen. And it doesn't have to be at this crazy high pressures of oxygen. Perfect is the enemy of good enough. We're just trying to get you to the point where we can do a little bit of healing and see how it goes. Get your body to start to heal itself. And that's what all these guys claim is that, wow, I started feeling better about 2 weeks into it. And then I started going back to the gym, which has its own positive side effects. And then I started drinking more water, which has its own positive side effects. Then I started talking to people more, which has its own positive side effects. And people don't get it. It's not one thing. It's everything all at once. Sorry.
No, love it, man. Love it. That's what our folks need to hear because it is everything. And you should be able to, we want to give that veteran a Chinese food menu of all these options and then map out all those things like, I was suffering from premature ventricular contractions till my sister, a nurse, said, "You only drink Diet Coke and beer. Why don't you try drinking some water?" Bam. No more PVC. I'm like, yeah, I felt better too. Still drinking to this day. But no, I mean, to your point, Joe, this is the passion that's going to drive this. And hopefully with the new administration, we get a little bit more traction than we've had, or a lot more traction. And we're up on the Hill and 2 pieces of legislation up there, both of them including HBOT as a modality to be considered, to be funded, to be covered, and to get this out there because this stuff saves money. It works. And all we need, is trials. Unfortunately, what we need are these gold standard trials that you know how to put together.
Unfortunately, but University of South Florida is working on that, right? So
love those guys.
It's so interesting because RFK, Trump, and Miss Shanahan all have a copy of my new book, The Art and Science of Hyperbaric Medicine. So
nice.
Right. I sent it to him. I'm like, here, I produced this book. I published this book. I'm going to buy my own copy and send it to these people so that they have the real information, the factual, the stuff that's in the literature and the research. It's a little probably high, but I figure if they have questions about hyperbarics, they can maybe consult the book or call, right? Like I'm into it. I'll do anything to help this project and to help our veterans. That's my goal for the rest of my life.
Yeah, we were into it too, man. And I think there's some other people that are trying to get HBOT at the Special Forces groups and the Navy SEAL teams. And dude, hey guy, just go in there, pick it up, jump in there, man, and hang out for a bit, right? Can't hurt, right? It's like better than drinking a
100%.
6-pack of beer, bro. You know, it's just
100%.
yeah.
As long
So
as you don't
Joe,
take your lucky cigarette lighter in with you, you'll be okay. Ah,
yeah, just don't be that stupid.
don't be
But
that
so
guy.
just tell us how people find you. I want to close this out with you talking about Joe Dituri, right? Where's Doc
Oh,
Joe
yeah.
Dituri at? How do people find you? How do they find your book? Do you have a podcast? Hey, what Guinness World Record do you hold?
Ah, the longest amount of time spent in the longest dive in the world, basically. It was 100 days of living underwater at pressure, right? Like there's been
Wow.
other people that live in submarines, but that's not at pressure. That's a totally different thing. I stayed underwater at pressure, did the longest dive in the world. So, because it's at the same pressure at which we treat traumatic brain injury here on the surface, I did that for that reason so that people could go, oh, all of his psychological, psychosocial scores got better. Look, his HSCRP went down, interleukin 6 went down. Oh, these are the mechanism of action of hyperbaric medicine. So it's not just, oh, I went to go chase a world record. Who cares, right?
Right.
And trust me when I tell you, this is not about me. If you want to get in touch, just Dr. Deep Sea, just Google that guy and you'll figure that guy out. I'm kind of sort of all over the place, but if you're interested in helping veterans, put your heart, your time, and your money behind a nonprofit like the Mac Parkman Foundation, like the other foundations that are out there doing good for traumatic brain injury. Don't worry about me. I am blessed and I'm terrific. Come look at what we're doing, but worry about those nonprofits and the people that are taking care of our veterans. Think about thanking your Florida legislature for doing this for the University of South Florida, that kind of stuff. Thank the people that are actually putting their money where their mouth is. Those are the people that need to be lauded for their decisions and appreciated for their steadfast nature, right?
Amen. Amen. And how do they sign up for the study, Joe? If they know somebody who's struggling or somebody
Yep.
that's had a TBI,
If you are a military veteran with a mild to moderate traumatic brain injury, click that link, that QR code that I sent you guys. Have them send that and just scan it, and it'll take them right to the website and and all they got to do is fill it in, and somebody will be in contact. Now, we're a little bit stuffed up, right? So it's going to be a little bit, we're behind, but that's okay. We're getting through these people. So we can't have too many. And even if we have too many, we'll go back to the legislature and say, hey, we got more than we need. Can we treat more people? You got any extra money?
Yeah, get some extra machines. Cool beans. All right. Well, Joe, thank you so much for your time today. Amazing bright podcast, man. You're an animal, man. We love having you on the show. You take care of yourself, boss, man. God bless you for what you're doing for our veterans. Yeah, it's going to be great. To all you out there, remember, we have an open town hall on March 28th featuring Dr. Joe Dituri. We're going to be talking about repetitive blast exposure, its impacts on veterans' brains, how to get treatment. We're going to have Dr. Or Mr. Michael Hartford, who used to be one of the lead directors for the VA, to talk to you about how to prep for a VA coverage and go to them and get claim these injuries that you might not even know that you might have had. And remember, we've got our book out there. It's for free. But turn it up right side up. Broken Brains. Get out there, get a copy of the book, send it to everybody. Know you can download it off our website for free. We don't want to make any money off it. Go get it. And our second International Summit on Repetitive Brain Trauma will be held in Tampa this year in September 3rd and 4th. Get those dates on the calendar. But again, Dr. Joe Dituri, all of our fans out there, thank you so much out there, and we'll talk to you next time on Broken Brains.